Good day, and welcome again to Learning Pharmacology with me, Nurse Myron. Today we will be discussing CNS stimulants. For our full disclosure, I am not affiliated with any of the manufacturers of the drugs or other items mentioned in this lecture. The mention of such brand names are only in passing and for educational purposes only, and are not for commercial promotion. I have no actual or potential conflict of interest in relation to this presentation. First, let's have an overview. Central nervous system stimulants are drugs that increase alertness, attention, energy, and physical activity on a patient. Typically, they work by boosting neurotransmitters like dopamine and norepinephrine. Let us do a quick review of neurotransmission. In our body's nervous system, neurotransmission serves as the process by which neurons communicate through the release of neurotransmitter chemicals to cross the synapse. An electrical impulse triggers the release of these chemicals, which bind to receptors on the target cell, causing excitatory, inhibitory, or modulatory effects. As part of this process, any excess neurotransmitters are reuptaken through transporters back into the presynaptic neuron. Regulating the intensity and duration of neurotransmitter signaling is a vital component of this process. It prevents overstimulation of receptors and the recycling of excess neurotransmitters for future release or degradation. So now we go into the different CNS stimulant drugs. CNS stimulants cover a broad class of drugs that increase the activity of the central nervous system. Medical indications of CNS stimulants include attention deficit hyperactivity disorder or ADHD, narcolepsy, asthma, obesity, nasal and sinus congestion, and even hypotension due to anesthesia. The exact mechanism of action of CNS stimulants is not fully understood, but they are generally observed to act by stimulating adrenergic receptors, typically by increasing the release of neurotransmitters. In this case, norepinephrine and dopamine, to increase the effect on the receiving neuron. The other mechanism is through inhibiting the reuptake of these two neurotransmitters, rather than binding directly to their receptors, as we can see here. Let us now go into the specific CNS stimulants. Amphetamines are legal CNS stimulants indicated for ADHD, narcolepsy, and even binge eating disorders. They work by increasing the levels of norepinephrine and dopamine while also inhibiting its reuptake. All forms of amphetamines like amphetamine under the brand name Adderall, amphetamine sulfate, lisdexamfetamine, and dextroamphetamine are currently not available in the Philippines. These brands are available abroad. Therefore, the drug of choice that is readily available here in the Philippines is methylphenidate under the brand name Ritalin. It is a commonly prescribed CNS stimulant used as a treatment option for ADHD and narcolepsy. Methylphenidate works by increasing dopamine and norepinephrine levels in the brain. It enhances focus and reduces impulsivity. However, it can cause side effects like insomnia, decreased appetite, and increased heart rate. Our next drug is ephedrine. Its availability is very limited because it is a strictly controlled CNS stimulant here in the Philippines. It is a treatment option for hypotension, but is only available in intravenous form. It directly stimulates adrenergic alpha-1, beta-1, and beta-2 receptors. In addition, it also blocks neurotransmitter reuptake in the brain. Ephedrine is a strong stimulant and carries risks of serious cardiovascular and neurological side effects, including heart attack, stroke, seizures, and even death. Common side effects include insomnia, anxiety, tremors, rapid heart rate, palpitations, hypertension, and nausea. It should be avoided by individuals with heart disease, high blood pressure, or thyroid conditions. Pseudoephedrine is a sympathomimetic agent that provides decongestant effects by stimulating alpha and beta adrenergic receptors. It works primarily by inducing vasoconstriction in the nasal mucosa via alpha receptors. This results in reducing edema and congestion, and acts indirectly by promoting the release of norepinephrine. Pseudoephedrine appears in a number of prescription formulations, especially in combination drugs like loratadine plus pseudoephedrine, marketed under the brand name Clarinase, paracetamol plus pseudoephedrine plus chlorphenamine maleate is sold under the brand name Sinutab Gold Plus or Decolgen FX. Our next drug is modafinil. The brand name is Provigil. It is a prescription-only stimulant medication that promotes wakefulness to treat excessive sleepiness caused by narcolepsy, shift work sleep disorder, or obstructive sleep apnea. It acts on brain chemicals to improve alertness and cognitive function. Common side effects of modafinil include headaches, nausea, anxiety, and insomnia. General side effects of CNS stimulants include irritability, hyperactivity, anorexia, insomnia, weight loss, tachycardia, palpitations and arrhythmias, and hypertension. CNS stimulant contraindications include severe hypertension, advanced arteriosclerosis, symptomatic cardiovascular disease like arrhythmias, hyperthyroidism, glaucoma, and agitated states. These drugs are also contraindicated with current or recent MAUI use within 14 days due to the risk of hypertensive crisis. Use of CNS stimulants is generally avoided in patients with a history of drug abuse, anxiety, or structural heart defects. CNS stimulant addictions are chronic relapsing brain diseases driven by the misuse of substances that enhance dopamine. It leads to severe cravings, tolerance, and compulsive use despite harmful consequences. Common culprits include illegal like cocaine, methamphetamine, and prescription stimulants like Adderall and Ritalin. Addiction develops through brain rewiring that necessitates higher doses for the same high, known as your tolerance. It also triggers harsh withdrawal symptoms. Nursing considerations for CNS stimulants focus on monitoring for cardiovascular risks. The nurse should closely monitor for hypertension, tachycardia, and palpitations, as these stimulants can cause serious cardiovascular events, including sudden death in patients with underlying heart conditions. Regularly measuring height and weight in children is also essential, as the stimulants may cause appetite loss, weight loss, and growth suppression in children. Lastly, nurses should monitor for new or worsening psychiatric symptoms such as mania, psychosis, or aggression. As was discussed earlier, CNS stimulants have a high potential for abuse. Therefore, close monitoring should be done. These medications are to be taken in the morning to avoid insomnia. In addition, caffeine should be avoided from coffee or even other beverages, as coffee and caffeine in itself is already a stimulant. Before I end, I made this short bonus section on illegal stimulant drugs. A short disclaimer. This section is for educational purposes. I also aim to educate about the harmful effects of these illegal drugs. First, we have methamphetamine. It is the chemical name for illegal substances like ice, speed, crystal meth, or locally known as shabu here in the Philippines. Methamphetamine is easily made in meth labs or shabu labs from pseudoephedrine or other precursor drugs. This is the reason why most amphetamines, while already legal abroad, remain illegal here in the Philippines. Note that methamphetamine is the illegal form of amphetamine. Methamphetamine crystals are heated to produce smoke to be inhaled by the user. Its effects typically last for 4 hours but can have a half-life of up to 12 hours. Up to 40% of methamphetamine is excreted unchanged in the urine. Next is cocaine. This drug is a highly addictive stimulant derived from the coca plant. The scientific name is Erythroxylum coca. This plant is native in South America. Cocaine is typically found as a white powder that is snorted or injected, or in rock form known as crack or crack cocaine, which is smoked. While abroad, it has limited medical use, such as local anesthetic, it remains illegal here in the Philippines. So just remember, say no to illegal drugs. And that concludes my discussion on CNS stimulants. Thank you for listening and continue enjoying learning.